Sean, thank you. This week, the state health department gave us an update on the COVID-19 dashboard to include cases of people who were reinfected with the virus a second time. That's at least 822 people, yet that is less than 1% of all Coloradans who've gotten COVID. Our Sean Chittin has talked to two people who've already had the virus, worry about getting it again. Thankfully, Sean, that's pretty rare.
Jim, it certainly is, but they are aware and concerned. These two people that we talked to, both here in Colorado, both under 30, but they got the virus at different times during the pandemic, one last year and the other just a couple months ago. And they tell us tonight they are being even more cautious because they know they could still get the virus.
I went to McDonald's one day, I couldn't taste a breakfast sandwich, and I thought that it tasted like couch foam.
Dakota Clark is a hairstylist who is still recovering from some COVID-19 symptoms. He got the virus in early January and still feels some of the effects almost 2 months later.
I wouldn't relax, because as soon as you think or you do relax, you'll be the one that gets it. Honestly, because that's what happened to me.
He said professionally and personally, he followed all the guidelines and stayed in a small bubble of people at work and home.
I got relaxed. One situation allowed a friend to come visit me, and then I got COVID.
Courtney Hitchings got the virus last summer and told us then she was extremely concerned about getting it twice. As a math teacher at Fairview High School, she worried about spreading COVID-19 too.
So I definitely treated it as if I could get it at any moment, and I still treat it like that. I mean, the vaccine is the vaccine and I feel great, but I feel safe, but you never know. And to me, there's no harm in just wearing the mask.
Now that she's fully vaccinated, she's still going out of her way to make sure she feels safe and those around her do too.
I wore 2 masks. I mean, I was still fully treating my life like I could get COVID any day.
Getting infected at different times and in different scenarios hasn't stopped these two from passing on the same message.
We should be super serious about it and try and protect ourselves.
And another challenge is the requirement to prove that someone has been reinfected with COVID-19. It is pretty rare because you have to have 2 positive test results that are at least 90 days apart, and then the lab needs to be able to study 2 different samples, and that's another reason why we've only seen a handful of those cases here in Colorado. Live tonight in Denver, Sean Chittin covering Colorado First.